DSW 2310, Dual Diagnosis, Treatment and Assessment, Chapter 13, Personality Disorders. What is personality? Includes typical emotional and behavioral characteristics, how one perceives, thinks about, and relates to oneself and the broader world. Personality disorder. Character traits go beyond cultural norm. Personality features are inflexible, maladaptive, causing functional impairment, personal distress. Personality disorder expressed in 2 out of the 4 areas of cognition, emotions, interpersonal relationships, impulse control. 12 different personality disorders are in the DSM-5, divided into 3 clusters. A. Eccentric, odd behavior. B. Dramatic, emotional, erratic behavior. C. Dominant traits of fear and anxiety. Medical conditions associated with personality change. Head trauma. Cerebrovascular diseases, group of brain dysfunctions related to disease of the blood vessels supplying the brain. Cerebral tumors, epilepsy, Huntington's disease, a hereditary disease marked by degeneration of the brain cells and causing chorea and progressive dementia. Multiple sclerosis, chronic progressive disease involving damage to the sheaths of nerve cells in the brain and spinal cord. Symptoms may include numbness, impairment of speech, muscular coordination, blurred vision, severe fatigue. Endocrine disorders. The endocrine system is a network of glands that produce and release hormones that help control many important body functions. The body's ability to change calories into energy, the power cells and organs. Heavy metal poisoning, manganese, mercury. Neurosyphilis, infection of the brain or spinal cord. AIDS. Borderline personality disorder, BPD. Cluster B. Affects 1.6 to 2% of the general population. Prevalence rate may be as high as 5.9%. Prevalence rates: 6% in primary care settings, 10% in outpatient mental health clinics, 20% in psychiatric inpatient services. PPD, extreme acting out behavior. 75% of individuals diagnosed with BPD are female. Features: instability of emotions, self-image, and relationships. Significant impulsivity. Leads a troubled life, not satisfied with relationships or personal accomplishments. Looks like they are in a continuous crisis cycle. Oversensitive. Emotions change quickly. Quick transition between excitement and extreme rage. Self-esteem variable. Depends on perception of how they're treated. Alters opinion of others. Affects relationships. Terrified of being abandoned. Reacts to normal separation with fear and anger. Comorbid. Experiences major depression. Features: care can be exhausting, are dependent and hostile. Relationships are tumultuous, unstable, intense. Will exploit people, little regard for feelings of others. Idealize or reject significant others, causes rifts among DSP, family, etc. An uncanny ability to infuriate caregivers and clinicians. Oppositional, irritable, demanding, etc. May engage in repetitive self-destructive acts, slashing wrists, self-mutilation, suicide. Criteria for BPD: frantic efforts to avoid real or imagined abandonment, pattern of unstable, intense interpersonal relationships characterized by alternating between extreme idealization and devaluation, identity disturbance, markedly persistently unstable self-image or sense of self, impulsivity in at least 2 areas that are potentially self-damaging: spending, sex, substance abuse, reckless driving, binge eating, recurrent suicidal behavior, gestures or threats, or self-mutilating behavior, affective instability due to a marked reactivity of mood, intense episodic dysphoria, irritability, or anxiety, usually lasting a few hours and only rarely more than a few days, chronic feelings of emptiness, inappropriate, intense anger, or difficulty controlling anger, frequent displays of temper, constant anger, recurring physical fights, transient, stress-related paranoia, ideation, or severe dissociative symptoms. Unhappiness of life for someone with BPD is overwhelming. BPD in persons with developmental disabilities. Prevalence rate is 27 to 35%. Women with developmental disabilities and BPD often get into trouble with the law and end up in jail, are often seen as criminals. Difficult to diagnose. Symptoms: personal relationships, most volatile and obvious clinical feature. Hysterical overreactions with staff. Impulsivity is concrete and goal-oriented. Drinking binges, overspending, stealing. Affective instability. Feelings change rapidly and last only minutes. Difficulties in controlling angry feelings. Verbal outbursts rather than physical aggression. Suicidal or self-injurious behavior. Take seriously. Self-injurious behavior can include self-mutilation. Symptoms: identity disturbances, less common. Concrete, such as confused and shifting sexual identity. Anhedonia, inability to feel pleasure, less common. Express feelings of boredom and emptiness, often ignore as this is common for people with developmental disabilities. Fear of abandonment. People with BPD make unreasonable demands and become hysterical and threatening if demands are not met. Diagnostic indicators: splitting, black and white thinking, all or nothing thinking. The individual tends to think in extremes. Actions, motivations are all good or all bad. Overreaction. Verbal aggression, which leads to physical aggression. Extreme mood changes. Not able to see connection between behavior and consequences. Devaluing others. Manipulative. Chronic emptiness. Impulsive self-destructive acts. Causes of BPD: heredity, genetic base, organic, reduced serotonin levels, activity, related to impulsivity, emotional instability, abuse or trauma. 33% report severe abuse experiences. Neglect, family background. Families have higher rates of impulsivity, substance abuse, antisocial behavior, chaos, and depression. Treatment of BPD: psychotherapy, therapist provided feedback and advice, limited setting. Behavior management, targets activities of daily living, verbally abusive behavior, physically dangerous behavior. Drugs. Support, maximize consistency and structure, chaos. Maximize appropriate social interactions, relationship building. Support the person to trust others. Ensure that there are opportunities for reasonable choices. Unpredictable and potentially dangerous behavior. Maximize the use of self-management strategies. Increase control and responsibilities. Teach alternative communication for emotions rather than acting them out. Set limits and boundaries with clear, realistic consequences. Do not take it personally. Initially, provide less stimulating and more controlled environments. Minimize chaos and provide structure. Maintain professional boundaries and monitor countertransference.